Okay, yeah, you can just get me.
Come in.
Hi, hello, Miss Williams. How are you today?
Good.
Okay, my name is Pierre, and I am an NP student, and I'm going to be doing your hand examination, including the lungs and thorax. Okay? I've already washed my hands, and I'm going to put on my gloves. Now, if you have any questions during this examination, feel free to ask. Okay? I'm going to be doing a series of tests. I'm also going to be touching and palpating and percussing. Okay? That just includes me touching you. Okay? Is that okay?
Yes.
Okay. So starting with this examination, I'm looking at your head, the contour. Your head is round, is normal cephalic, atraumatic, which just means right now I don't see any visible injuries, okay? I don't see any mass or lumps on your head. So now I'm going to be touching for those things, okay? All right, we are palpating for any lumps or mass or any depression as well. There's none. Looking at your hair, you have good hair texture as well. Coming down to your face, I see that your eyebrows are symmetrical and the hair on your eyebrows are evenly distributed. So does your eyelashes. There's no crusting on your eyes, and there's no tears, no watery, no discharge in your eyes. Your medial and lateral canthus are nice and moist and pink. I'm gonna be touching you now. Conjunctiva is pink and moist. Okay. All right. Very good. And also looking at your eyes on the external, I see that your iris is brown. The sclera is nice and white. No corneal abrasion is noted. Now, I'm going to be looking at your eyes, okay? Open up your eyes. Look at me straight. Okay. Very good. Okay. So your eyes is nicely round and reactive to light. Your pupils, okay? And I'm gonna be doing the consensual exam, direct and indirect. Right now, keep looking at me straight. All right, we see that the pupils on your left side, left eye constrict. I'm gonna do that, and I'm gonna look for the pupils on your right eye. They also constrict, okay? So that's the consensual light reflex. I'm going to be doing the confrontational test. Just let me know when you see my fingers, okay? Let me know when you see my finger. Okay, look at me straight. Let me know when you see my finger. Okay, very good. That's to test your peripheral vision. Also going to be doing your EOM exam. That's just to check for extraocular movements. Okay, just follow my fingers. Look at me. Don't move your head, okay? Just follow my fingers. Very good. Okay, very good. Now, I'm looking at my finger, and I'm gonna need you to stare at the object right on the wall, okay? All right, look at my finger first, then look at the object. Look at my finger, look at the object. Okay, this is just to show that with distance, your eyes, your pupils, they dilate, they become bigger, and with closer object, they constrict, they become smaller, okay? Now we're gonna do the visual acuity test with this Snelling chart. I'm just gonna step back 6 feet, and then you're gonna tell me what you see, okay?
Okay.
All right.
EPTZO.
Very good.
LTFPH.
Okay, very good. You have 20/20 vision. Okay. Now I'm going to be doing the fundoscopic eye exam, which is me looking inside of your eyes. Okay.
Okay.
All right. So I'm going to be using my right and then onto your right. Okay. So you could turn for me. All right. Okay. All right, so I could see that right away. The red reflex is present. The optic disc is sharp. The margins are sharp, and we have a small cup. There's no AV nicking, and the macula is nice and intact. Okay, so that's good. Eye test, eye exam. Now coming down to your face, I'm gonna check for your temporal pulse. Okay, nice and brisk. A +2. Looking at your nose, there's no abrasion, no cuts, no bleeding. Can you smell for me? Okay, out the nose. Okay, very good. Any tenderness?
No.
Okay, palpating your sinuses. Any pressure, any tenderness? Any any pressure or tenderness? Very good. Now I'm going to be looking inside of your nose, okay? All right, tilt your head back for me. Okay. Very good. Okay. Now looking inside of your nose, the nasal turbinates are nice and pink. Your septum is midline. There's no deviation. There's no hematoma, no polyps, no drainage inside of your nose, and there's good patency, and you smell good. You were able to smell, right? Okay. Now coming down, we see that the mouth is nice and pink. There's no lesions, no crustacean. Open up for me. Okay, the tongue is midline. There's no lesions, no scars or nothing. Good dentition. The floor of the tongue is nice and moist. The soft and hard palate. Okay. All right, nice and intact. There's no injury, no bleeding. Stick your tongue out for me. Say ah. Okay, the uvula is midline. That's okay. The uvula is midline. Your tonsils are within normal range. They're not swollen. There's no exudate. There's no pus noted on your tonsil. Okay. Now looking at your ears, I can see that the external ears, there's no drainage, discharge coming out of your ears, no foreign bodies. Any tenderness? No. Okay, I'm palpating the tragus, the pinna in your auricles and the mastoid process. Any tenderness? No. Very good. Now I'm going to be looking on the inside of your ears, okay? All right. Okay, I'm going to pull the pinna up and back. Okay, looking at your ears. Okay, I see that your tympanic membrane is nice pearly gray with good cone-like. There's no perforation, no inflammation. There's also no foreign bodies in your ears, no discharge in your ears. Okay, now we're going to be doing some hearing tests, okay? Now, close one of your ears for me. Put your hand over. I'm going to whisper something. You let me know what I whisper, okay?
ABC.
Okay, do the other ear.
1, 2, 3.
Okay, very good. So now we're gonna do the Weber and Rhine test. I'm going to place this tuning fork on top of your head, and you're gonna let me know if you hear sounds on both ears. Okay? Do you hear sound on both ears?
Yes.
Very good. Okay, so that's good. Hearing conduction test. So I'm gonna now do the other test where I'm gonna place this tuning fork in the bone of your ears. When it stops, you let me know, and then you'll let me know if you hear it after that, okay?
Okay.
Let me know when it stops.
Stop.
Do you still hear it?
Yes.
Very good. So that means ear conduction is greater than bone conduction, okay? So now we're done with that. Now looking at your neck, there's no mass noted, no tracheal deviation. I'm going to be palpating, okay? All right, no mass. The trachea is midline. There's no lumps noted, okay? Now I'm going to be checking for your left nodes, okay? All right, we're gonna check the pre-auricular, post-auricular, occipital lymph nodes, non-palpable. The tonsillar lymph nodes, non-palpable, non-tender. Submandibular lymph nodes, non-palpable, non-tender. The submental, non-palpable. The supraclavicular lymph nodes are non-palpable. Turn your head this way for me. Okay, we're gonna do the superficial cervical chains, non-palpable. Posterior cervical chains, non-palpable, and the deep cervical chains are non-palpable as well. Now I'm going to be assessing your lungs, okay? Now looking at you, you are breathing regular, you're not in distress. Your respiratory rhythm and rate is within normal range. You're not using any accessory muscles. There's no retractions noted. Okay, no nasal flaring. You're not cyanotic. Your mouth is nice and pink. Okay. Before I listen, I'm going to be just touching. Okay. I'm palpating for any tenderness, any mass or lumps as well. Any tenderness? No, not noted. Okay, very good. Now I'm going to be percussing your lung sounds. Okay. Okay, I see that we have a nice resonant. Okay, sounds. Now I'm going to be listening to your lungs, okay?
Okay.
Okay, breathe in for me, bring it in and out. 1, 2, 3. Good. 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 We have very nice and high-pitched tracheal sounds. We have good vesicular breath sounds all over the lung fields, interiorly, bilaterally. Okay, now I'm going to do the back as well, okay? So the same thing that I did, I'm going to be doing from the back, okay?
Okay.
All right, so looking at your back, symmetrical. There's no accessory muscles being used, no effort, no labored breathing. Breathing pattern is normal. I'm going to palpate for any tenderness and mass. Any tenderness?
No.
Very good. While I'm here, I'm going to do the chest expansion test. Just breathe in for me. Very good. Now I see that my hands, they move equally, evenly. I'm going to now palpate, touch, and I'm going to ask you to say 99. Okay, say 99 for me.
99.
Mm-hmm.
99.
Okay.
99.
Mm-hmm.
99.
Very good. There's good vibration bilaterally, so good tactile fremitus noted. So now I'm going to percuss the lung sounds, okay? Okay. Now I'm going to be listening. All right. Just breathe in for me. In and out. In and out. Okay, we have vesicular lung sounds all over. Thank you. In and out. Okay, very good. Now that concludes our test. Everything was normal. Okay, thank you.